So as far as where dentists are going right now, a lot of the dentists that we work with choose to work with a demographics firm to really understand the market. And depending on their specialty and the demographics company that you're using, it may be somewhere between a population of 1,400 to 2,000 people per general dentist in a given area. So when they're looking at those numbers, they really try to figure out where is there a hole and a need for dentistry right now. The other thing they have to consider is, a growing market. If there's a market that's booming right now and a lot of population moving into an area, there's going to be a need for dentists coming up. So we usually want them to have some level of either a consultant or a demographics firm that they're working with, someone that can help kind of drive those numbers. And again, it's a little bit different when you're talking about an orthodontist versus an endo versus a general dentist of what those numbers per dentist look like, population per dentist. But they try to make those numbers work and they try to make it fit within what a given area can handle in terms of number of dentists. The trends of dentists versus physicians. So our firm, Carr Healthcare Realty, we also work with physicians, physical therapists, veterinarians. I'd say the main difference is in the private practice space for physicians. They moved away from the private practice the last few years, and a lot of the hospitals have started to gobble those private practices up. We've seen a trend where they're starting to come back out of those scenarios now, and it's going back more into a private practice type setting. It can make a lot of sense for two physicians to come in very close proximity to one another if they're able to refer patients back and forth. So you may see a physician group exist much closer together than you would two dentists. In our world, in Carr's world, we really get to know the market as much as we can, especially in the dental world. So we want to know where all of the dentists are and kind of what the trends are. There are times when we will have an ortho come to us and say, listen, we really want to be located near a general dentist. It may make sense for those two practices to be side by side because they can refer patients back and forth. So you see that there's just far less dentists than there are physicians. So the number of times that that's happening happens a little bit more in the medical side than it does in the dental world. But we try that as much as we can, that if there are two specialists or a general and a specialist that would make sense to have in the same area, we're directing the clients to, hey, take a look at this property. This may be a good feeder system back and forth.